So I do chair a Department of Family Medicine, and mostly what I think my job is, especially since this department has become big enough and differentiated enough and has enough people in it who actually know how to get work done, my job is to stand on the table and go, you know what we could do? And I think that's why Val invited me, so I can say, you know what we could do? And then it's your turn to say, but you can't say, yeah, but. So I have one idea that I'm going to tell you about that is an idea that we have been pursuing for about 5 or 8 years at my place that I think is really important for family medicine and makes sense for this place to think about. I don't know you well enough to know if you should do this or if it would work here. I don't know if it'll work at my place. Some of it already is, but I have one idea. But I want to set that up by talking about a couple of things in terms of attitude that enable the little idea that I'm going to present to you to work, to be possible, to kind of create the right kind of ground for it, create the right kind of attitude and have the right kind of aspirations so that we can even have the conversation. So I think the kind of Department of Family Medicine that is good at trying important, scary stuff is a place that has gotten real comfortable with failure. I think you can't succeed unless you really know how to fail. We all grew up so paranoid about not getting 100 that we actually have a tendency to hide our failures. Fail! Fail fast. Fail smart. Learn from your failures. Wear your failure as a badge of honor. Use your failure as the best instance for learning that you can get. And so cultivating a department that celebrates failure is a really good idea. I have a sign on my desk that says, success requires failure. Fail fast. Fail smart. I have a lot of signs in my office, and you'll hear about more of them in just a minute. Another thing that I think is really important is to have fun. If I'm an 80-hour-a-week guy, I work hard. That doesn't mean you can't have fun. That doesn't mean, I think if I don't walk down the hall and hear people laughing and having fun with each other, then something's wrong. We've got something that needs to be fixed. Laughter is supposed to be a normal element of work. And this is work that we're doing. Third thing is that you've got to give yourself some breathing room. You know, if your schedule is so packed, if you're so tight that your head is stuck against the ceiling, you got to give yourself some breathing room so you can get it into the attic. Otherwise, you don't have any maneuvering room. One of the things that we do at my place is give people paid time to go work out. We have a fitness center on our campus. You can go do that free. It's a good idea. It pays for itself. It turns out to be not only not expensive, but the benefits that we enjoy in terms of productivity and morale more than cover the cost of that. And also spend a lot of time when the weather starts getting a little bit warmer than this in the park throwing frisbees and things. That's work. That's good work. That's actually when I think of some of the best things I think of that have to do with, you know what we could do, is when we're doing that kind of work, throwing a frisbee. There's a certain kind of preparation and there's a certain kind of discipline that goes with all of that, though. I think I have another sign on my desk that says, solve the problem before it exists. So I think it's really important when we're being playful and when we're having fun and when we're lighthearted about our serious work that we look for things that have not yet come up over the horizon and look beyond our field. And one of the things, the idea that I'm going to talk with you about in just a second is an idea that goes beyond the circle of family medicine. I think it's very helpful and it's very important to do that. We're all trying to do something that's bigger than ourselves. Well, let's get really bigger than ourselves and think about things before they appear and think about things that go beyond what you consider your business. The aspirations, I'm going to just say one thing about this and then I'm going to kind of get to the point. I have a sign on my desk. It's an epigraph from a book that I read. It was a completely different book than I thought it was when I bought it. It was called End Malaria. And it's a book about leadership and the progress in leadership. Doesn't have anything to do with malaria except all the money they made from the book they bought mosquito nets with, sent to Africa. It says, never undertake a project unless it is manifestly important and nearly impossible. Why waste your time on easy stuff? That's for the mediocre people. Easy stuff is only when you're so tired you can't do the hard stuff. Never undertake a project unless it's manifestly important and nearly impossible. Another way to say this is our friend Mike McGill works at a place in Utah that has as their epigraph on their kind of innovations rag that they send out to everybody. It says, the difficult stuff we do right away. It's the impossible stuff that takes a little longer. So here's an impossible idea. I started thinking about how almost how ironic it was, and really how unkind it was for me and us to be training in a Department of family medicine residents, training family docs in a patient-centered medical home in teams, as we have for a long time, only to send them out into the world where there aren't any teams for them to work with. What is that? What kind of thing is that? What kind of training is that? To send people out into the world where they're going to meet the kinds of people that they work with on teams, but that don't practice in teams. That's a wrong idea. That's a bad way to train. And in thinking my way through that problem, I actually woke up in the middle of the night one night and said out loud, woke my wife up, said out loud, I'm not in the business of training family docs. And she kind of went, yes, you are. Go back to sleep. What we should be in the business of doing is training the primary care workforce, not training family docs, training the primary care workforce. Now, that's easy to say, but if you take that notion seriously, here's how it plays out. Training the primary care workforce means the people who are working in a primary care setting to render primary care in wherever it is they go to after a training period, whoever those people are that collectively constitute really what I would say is the ideal primary health care team, I am personally responsible for training 100% of them. And who's in our clinics? Well, we've got clinical pharmacists there. We've got nurse practitioners. We've got PAs, PA students. We've got care managers, MAs. We've got occasional psychiatrists. We've got a lot of psychologists and social workers. We've got a whole raft of disciplines that collectively render care for the primary care patients that are seen at the A.F. Williams Family Medicine Center or at the Westminster Family Medicine Center and so forth, the places where we actually train family medicine residents and we actually work in partnership with all of those other disciplines. So if I believe that my personal responsibility is to train the primary care workforce, here's how that idea plays out. First thing we've got to do, we've got these psychologists that come to us. Some of them are there because it seemed like a good idea on paper. And our pay was a little bit better than they might have been making at the VA. And it takes a couple of years before they kind of get the deal about primary care behavioral health. But mostly we have people who are good at this, who understand what the behavioral dimensions of primary care are and work as contributing leaders in the primary health care team. But But it's hard to hire people who already get that and who already know that. So we have to develop, and we have, a psychology internship and psychology postdocs and social worker graduate training. Those are people who need, I don't train them into their guild, but it is my personal responsibility to teach them how primary care is done from the perspective of a psychologist. Now, this makes me very uncomfortable. I don't know how you train psychologists. I don't know how to set up a psychology internship, but we have one. This is a good idea because that year of training under supervision with psychologists who know how to do this results in psychologists who have graduated from training in partnership with family docs and actually go into practice with them. This is a good idea. This is taking personal responsibility. We now have as you do here, an addiction medicine fellowship. We have addiction medicine fellows who work in our family medicine clinic doing pain and addiction work. This is a good thing. Setting up an addiction medicine fellowship scared me to death. I did not know how to do that. Once in place and once rolling, works very well. We have a residency program for clinical pharmacists, primary care clinical pharmacy. We're making a partnership with the community college in Aurora near our academic health center to train care managers from community. Community colleges can do this better than universities. Community colleges, in case any of you don't know this, are major secret weapons. They can put a curriculum together before the sun goes down. And it also grows up in all of the community colleges in your state. So they can actually put together a curriculum for part of our primary healthcare team. In partnership with them, we're taking personal responsibility for training them. So what I think you ought to do, you know what you could do? You could create a NIDUS for preparing the primary care workforce. That doesn't just mean training family docs. You're personally responsible for that, but you're also personally responsible for training the MAs, for training the care managers, for training the community workers, for training the clinical pharmacists, for training them together and making that such a beautiful experience that they want to go work together afterwards. So how's that for an idea for you?